Bon vendredi, tout le monde. It's been a difficult year. There's no other way to put it. But when times get tough, Canadians step up. I want to start today by thanking all Canadians for all their efforts in the fight against this global pandemic. You've made a lot of sacrifices over the past many months. You helped keep people safe. You helped save lives. Everything we did, small and big, in following public health orders, in making sure that ourselves and our loved ones and frontline workers were safe, made a difference. So thank you. On this 8th and final day of Hanukkah, and with only 1 week to go until Christmas, there are more than 75,000 active COVID-19 cases across the country. Deaths per capita are continuing to rise in many G7 countries, including Canada. Countries around the world continue to feel the pain of the second wave. We need to take this very seriously as numbers continue to head in the wrong direction. Our fight against this virus is not over, even as we're preparing to say goodbye and good riddance to 2020. It may be the holiday season, but we have to be more careful than ever. On Monday, vaccinations started for the most vulnerable and our frontline workers. Canada has secured agreements for up to 417,000 doses of COVID-19 vaccines ahead of schedule. This includes over 200,000 early doses of the Pfizer vaccine scheduled for next week and 168,000 doses of the Moderna vaccine before the end of December, pending Health Canada approval. I want to assure you again that any vaccine approved in Canada will be both safe and effective, and that health experts are making those decisions independently. In January, we'll be getting 125,000 doses of the Pfizer vaccine per week for a total of about 500,000 doses for the month. With the guaranteed millions of doses coming in 2021, every Canadian who wants a vaccine will get one, no matter where they live. This is the largest immunization campaign in our country's history, and I know that we have the right plan and the expertise that we need. But getting a vaccine in a week or in a month won't do you any good if you catch COVID-19 today. That's why we need to keep working to halt the spread of COVID-19. So please, continue to follow public health guidelines. Avoid gatherings, practice social distancing, use the COVID Alert app, do the right thing for the most vulnerables, and think of being careful as a gift you can directly give your fellow Canadians, especially frontline workers who continue to step up every single day to keep us safe, to keep Canadians safe. Nous faisons beaucoup d'efforts pour nous assurer que les Canadiens aient accès à des vaccins sécuritaires et efficaces partout au pays. En même temps, nous travaillons aussi à nous procurer et à développer des traitements pour combattre la COVID-19 ainsi que d'autres infections virales. À ce sujet, j'annonce aujourd'hui un investissement de près de 9 millions de dollars par le biais du Centre national de recherche du Canada pour soutenir le développement de ces traitements. Cet investissement ira vers 4 compagnies pour leurs candidats de traitement contre la COVID-19, dont 2 à Montréal et 2 à Vancouver. Il est important de continuer à développer des solutions ici au Canada afin de lutter contre la COVID-19 et de se préparer pour d'autres éventuelles pandémies. C'est en travaillant avec les chercheurs, les scientifiques et les entreprises que nous allons y arriver. For many Canadians, the holidays are a time to cook good food and have a few extra pieces of dessert because, well, why not? But for far too many others, the reality is very different, especially during this pandemic. More than a third of Canadians who rely on food banks are children. That's unacceptable. In a country like Canada, no child should go hungry. In October, our government announced another $100 million under the Emergency Food Security Fund, doubling our investment from the spring. This morning, Minister Bibeau outlined the details of where that additional funding will go, including $30 million for food security in First Nations, Métis, and Inuit communities. With these funds, food banks, local food organizations, and Indigenous groups will be able to purchase and safely distribute food to help vulnerable people and communities. I want to say a special thank you to all the volunteers and workers at food organizations who've stepped up to help their fellow Canadians. I met many of you virtually in October, and I remember you sharing how you had to adapt really quickly when the pandemic hit. Thank you for your work, your time, your generosity, and for your commitment. Je sais qu'on aurait tous espéré que la situation soit différente pour les fêtes. L'année a déjà été difficile et on vous demande encore de faire des efforts. Mais ce n'est pas le temps de lâcher. Il y a de l'espoir. On sait que les vaccins arrivent. On n'était pas sûr qu'il allait y avoir des vaccins contre la COVID-19 quand on en parlait il y a 6 mois. Mais nos chercheurs, nos scientifiques ont fait un travail incroyable ici au Canada et à travers le monde. Et on sait maintenant que cette pandémie a une fin et elle s'en vient. Mais elle n'est pas là encore. On a des millions de doses de réservées pour les Canadiens. Tout le monde va pouvoir être vacciné en 2021 au Canada. Mais avant d'y arriver, il va falloir qu'on passe ensemble un hiver difficile. Alors continuez de faire ce que nous faisons depuis des mois, de faire attention, d'éviter les rassemblements, de suivre les consignes de santé publique, de télécharger et d'utiliser l'application Alerte COVID, d'éviter des rassemblements. Noël ne sera pas pareil cette année, mais ça va être encore un moment, ça va quand même être un moment pour être là, virtuellement ou en personne pour les plus proches, pour réfléchir à cette année difficile, mais surtout réfléchir à comment on a pu passer entre de dizaines de milliers de Canadiens qu'on a perdus, mais de redoubler notre engagement pour avoir un Noël en 2021 encore meilleur et de loin meilleur que celui qu'on passe maintenant. On pourra le faire, mais il va falloir continuer à tenir bon. On peut offrir notre vigilance en cadeau aux travailleurs de la santé, ceux de la première ligne qui sont là pour nous protéger, pour continuer à travailler même pendant le temps des fêtes pour sauver des vies. Nous avons tous un devoir de les protéger et nous avons la capacité de le faire. Continuons de faire ce dont on a besoin et on va passer à travers. Since the beginning of this crisis, our government has done everything we can to protect you and your family. We've sent millions of pieces of PPE to the provinces and territories. We've created special programs for families and workers who needed it. We've supported small businesses so that they could stay open and hold on. We've presented historic measures to rebuild a more resilient economy that works for everyone. Now, I know that this won't be the kind of holiday season we might have hoped for, but that doesn't mean we can't feel hopeful about what comes next. When this new virus started spreading, few people thought we'd have an approved and safe vaccine so quickly. So thank you to our scientists, to researchers, and to experts around the world who stepped up and worked incredibly hard. You've all done incredible things this year, and it's important that we keep supporting you in the work you do, and that we keep listening and trusting you in your expertise and your work to keep us all safe. The vaccination campaign has started. Millions of doses are already secured and will be coming in the coming months. We planned thoroughly. We're relying on advice from the best experts, and we're working with the provinces and territories to roll them out. Canada has the most vaccines secured per capita and the most diverse portfolio of vaccine options in the world. We're also doing our part to help developing countries get access to more tests, treatments, and vaccines so we can fight this pandemic everywhere. There are reasons to be hopeful for 2021. Just like through this spring, summer, and fall, we will continue to be there for you. We will have your back, every step of the way, we will do as a government whatever it takes for as long as it takes to keep you safe and supported. We're coming into the final miles of this crisis, and we can't give up now. So stay home, stay safe, and we will get through this together. Joyeux Noël tout le monde. Merry Christmas, Happy Holidays, and mostly Happy New Year.
Thank you, Prime Minister. We'll now turn the phone for questions from media. Just a reminder, one question, one follow-up. Operator.
Thank you. Merci. Première question, Raymond Fillon, TVA. À vous.
Merci beaucoup. Bonjour, Monsieur le Premier ministre. J'aimerais revenir sur la PCU et ces milliers de personnes qui sont invitées à rembourser des prestations avant le 31 décembre. Dans plusieurs entrevues cette semaine, vous leur dites de ne pas s'inquiéter, que l'ARC sera indulgente, mais j'aimerais que vous soyez très concret. Qu'est-ce que ces personnes doivent faire? Est-ce qu'ils doivent ignorer la lettre? Quelle est la marche à suivre exactement?
Merci Raymond. On sait d'abord qu'il y a eu déjà des millions de paiements à l'ARC au cours des derniers mois de gens qui ont reçu trop de PCU ou le PCU quand ils n'en avaient pas le droit. Alors, les Canadiens comprennent à quel point c'est important d'être équitable et d'être responsable avec tout ça. Mais je sais aussi, et j'ai entendu directement de Canadiens qui sont préoccupés par cette information qu'ils ont reçue de l'Agence du revenu. Et ce que je leur dis, c'est ne vous inquiétez pas. Vous n'avez rien besoin de payer avant la fin de l'année. C'était pour information seulement. Et je vais vous dire qu'on comprend que dans les centaines de milliers de personnes qui ont reçu ces avis, il y a des gens dans beaucoup de différentes situations et on va regarder ces situations dans les mois à venir pour pouvoir s'assurer qu'on est là pour aider les plus vulnérables. Je vais vous dire, rassurer directement, on n'a pas donné de l'argent à ceux qui en avaient besoin pour ensuite le retirer à Noël. On est là pour aider les plus vulnérables. C'est la promesse qu'on a donnée en tant que gouvernement et on va continuer de faire cela.
Suivi, oui.
Donc, les gens ne seront pas imposés parce que c'est ce qui est écrit noir sur blanc dans la lettre. Là. Si vous ne remboursez pas avant le 31 décembre, on va vous envoyer un slip, là, Alors, il n'y en aura pas? Vous confirmez qu'il n'y en aura pas de...
Je peux confirmer que les gens qui ont fait des erreurs de bonne foi, qui auraient peut-être pas dû avoir ce paiement, n'ont pas à s'inquiéter pour des pénalités ou pour des intérêts. On va travailler avec tout le monde. La pandémie est encore en cours. Les gens sont encore et continuent d'être anxieux, inquiets. C'est un Noël pas comme les autres. Je veux pas que les gens soient inquiets à ce niveau-là. J'ai fait une promesse, on allait soutenir les gens qui en avaient besoin et on va continuer de le faire. Okay. I think people need to know that we're serious when we said we would be there for people. We didn't deliver support to millions of Canadians who needed it just to claw it back at Christmas. Already we've seen over 1 million repayments of people who got the CERB payments unjustly or extra CERB payments. And that's because Canadians are fair and fair-minded and responsible. But every step of the way, we've promised to be there for vulnerable people. So I don't want this to be an extra stressor on a Christmas that is already not like others. So be reassured, any good faith mistakes will not be penalized, will not be pursued. We're going to work with people over the coming weeks and months to ensure that people get the support they need. I think all Canadians want to be focused on the things that matter the most this Christmas, your health, the health of your loved ones, and the opportunity to recollect this past year and look towards the next year with renewed optimism. These letters should not be a source of anxiety for anyone.
Thank you. Next question, please, operator.
Thank you. Merci. Next question, Dylan Robertson.
Pablo Rodriguez told Le Devoir that you can't increase health transfers because the structural expense would jeopardize Canada's credit rating. You've never mentioned the credit rating issue in this context before. In fact, you said you will increase health transfers. So is Mr. Rodriguez making this up?
Obviously, we're proud of Canada's very strong credit rating because it contributes to us going into this pandemic with one of the strongest fiscal balance sheets of any of the G7 countries, and we continue to have it. But as I've said, our focus is on being there for Canadians as long as they need it, whatever it takes during this pandemic, and that's what we're doing, which is why we have flowed billions of dollars in supports directly to Canadians, to workers, to families, to small businesses, why we've flowed money to provinces to support the most vulnerable, to help with their health systems, why we've delivered on PPE, on rapid tests and testing kits, and now on vaccines that we're paying for. We have demonstrated every step of the way that we're doing what it takes because we know that that's not just the right thing to do, that's the best way to ensure that our economy comes roaring back for the long term. I have said we will sit down and work with the provinces on expanding health transfers because we know that long term there is a need for that. But those decisions are to be taken once we see the other side of this pandemic and we have a better idea of what the future looks like. Our focus is on being there to support Canadians, and that's what we're going to continue to do.
And a follow-up, Dylan?
Okay, so you didn't actually answer the question on the accuracy of that statement, but I just want to ask about Revera and the pension plan. Revera has given false information to Winnipeg health officials numerous times about its nursing homes, like how many staff it had during outbreaks. Revera is owned by the public sector pension plan, so why are you not leveraging those shares to get the company to increase its staffing in care homes?
Right now, our focus is on supporting seniors, vulnerable Canadians right across the country with whatever is necessary. That is why we have worked closely with the provinces on extra help. We put forward $1 billion more in the fall economic statement to help with infection control and prevention and other measures in long-term care homes. We continue to work with the Red Cross and we sent in the Army through this past month, and we are focused on being there to support vulnerable Canadians and seniors during this crisis. I have no doubt that as this crisis in its current exigencies draws to an end, there will be many reflections about how we deliver long-term care to seniors across this country in a way that respects their dignity, their safety, and ensures the best quality of care right across the country. The federal government is happy to be part of that conversation, and part of those reflections that I know provinces are going to have are around differing outcomes in different styles of care homes. I think those are important conversations to have, but right now our focus is on doing everything we can to support the vulnerable Canadians in those care homes.
Thank you. Next question, please, operator.
Thank you. Merci. Next question, Tonda McCharles, Toronto Star, line open.
Good morning, Prime Minister. Speaking of what you were just talking about, reflections on lessons learned and whatnot. Sorry. You spoke, when you spoke to us after you met with the premiers, you said that you thought it was necessary to take lessons on public health from what was happening in this pandemic, and that we had to learn lessons just as we did through SARS. And yet I don't hear you ever suggesting sort of what that looks like. I know there's an in-house lessons learned exercise going on at Health Canada, but can you speak more specifically to how you would like to see that lessons learned exercise unfold? Is it a federal inquiry? Do you think each province has to undertake their own? What do you see?
I think every day during this unprecedented pandemic, we have been learning from what we did the previous days, the previous weeks, and that is ongoing, so we can make sure that every given listening to our experts, it means looking at the outcomes of what we've been able to do. It means learning from what other jurisdictions are doing, and certainly this has been a constant exercise in examining what has been done, what could be done better, and bringing those in as quickly as possible. Of course, as we get through this pandemic, there are going to be many, many larger lessons to learn, to set down, and to set in place so that future governments faced with similar situations, although we certainly hope not, will be better equipped with what we've learned through this pandemic. I think that is simply understood, that we will have to be very serious about making sure we learn all these lessons that were tragically extremely hard learned through this pandemic. But we haven't yet decided or determined what that looks like. We're still very much focused on getting through this second wave right now.
And the other day, when in one of those year-end interviews, you told an interviewer that you in contemplating, when the next election might happen, possibly in 2021, you said while your government won't is not necessarily in the driver's seat on that, but you are, that an election, first you have to get through the pandemic. You said we have to get through the pandemic first. So I'd like to understand, what does that look like to you? What do you determine, what will determine when we're through the pandemic? Is it 50% of Canadians vaccinated? Is it a certain level of control of infection? Can you speak to that? When do you deem us to be sufficiently through the pandemic?
I think you lay out exactly sort of the range of reflections and uncertainties that we know for 2021. We know that we are going to be vaccinating millions of Canadians and vaccinating every Canadian who wants it, and that will get us significantly through this pandemic. We know that experts still have to evaluate carefully which threshold of vaccination will allow us to start releasing some of the restrictions in various places across the country. Will they be in certain sectors, or will they be in certain regions? There are many things we don't know. What we do know, however, is we're still very much in the middle of this second wave, and the decisions that we take now as Canadians to keep ourselves safe are going to make a difference for the coming months. As to political considerations and what decisions happen around elections, well, we will see, because that's not our focus right now. Our focus is on supporting Canadians now and in the months to come, and getting them vaccinated as we get through this pandemic.
And Glenn McGregor, CTV News. Prime Minister, the United States is expected to vaccinate about 10 times as many people per capita as we are by the end of the year. And this schedule of Pfizer deliveries you just mentioned looks like the rate of deliveries is going to be constant. It's the same rate we're receiving them in December as we'll be getting in January. My question is, what are you going to do to close that gap, given that the strategy you've talked about, the broad variety of candidates, is kind of a gamble? We don't know they're going to be approved. We don't know when they're going to be delivered. But we do know at the current rate of the one approved vaccine, the Americans are going to vaccinate a lot higher percentage of the population before we do. What do you tell Canadians about that gap?
Indeed, we have secured, as you point out, one of the best ranges of vaccine portfolios of any country in the world, and we've secured more potential doses per Canadian than anywhere else. So we know that while it is important, and it is great news that we're starting to vaccinate now in December ahead of schedule, it is once we get a significant proportion of the population vaccinated that we will start to be able to look at loosening restrictions. The Americans have a healthcare system that will have challenges and will have successes. We have our own process. We're focused on our own process to make sure that as many Canadians as possible get vaccinated as quickly as possible with vaccines that are safe and effective and approved by Health Canada. We are, of course, watching approvals elsewhere around the world, but the decisions made as to what is right for Canadians and what is safe for Canadians will be done by the Canadian experts who are putting our safety first with a gold standard of approach that is the envy of the world. We will continue to focus every step of the way on delivering safe, effective vaccines for as many Canadians as possible, as soon as possible.
En français, s'il vous plaît, Monsieur Trudeau.
Nous allons continuer de nous concentrer sur l'importance de livrer des vaccins sécurs et efficaces au plus grand nombre de Canadiens le plus rapidement possible. Effectivement, on a le meilleur portfolio de vaccins potentiels de bien des pays et on a aussi plus de doses potentielles par personne que bien des pays. Mais en même temps, nous savons ça va être encore bien des mois avant qu'on atteigne un niveau où on va pouvoir relâcher certaines restrictions. Et pour ça, il va falloir qu'on écoute nos scientifiques pour mettre les Canadiens à l'avant-plan au niveau de protéger leur santé et leur sécurité.
Bonjour, Laurence Martin de Radio-Canada. Bon, sur la PCU, je comprends que vous dites que vous n'allez pas abandonner là, les Canadiens qui sont dans le besoin, mais il y a quand même des travailleurs autonomes qui n'ont pas beaucoup d'argent, qui vont devoir la rembourser, cette PCU. Et en même temps, il y a des entreprises qui ont profité des subventions salariales pour enregistrer des très gros surplus, pour verser des dividendes à leurs actionnaires. Et eux qui ne devront pas rembourser cette subvention-là, est-ce que vous reconnaissez qu'il y a une injustice?
On faisait face à une pandémie, à une crise sans précédent. Et en tant que gouvernement, il a fallu qu'on fasse une décision. Est-ce qu'on analyse chaque demande au mois de mars et avril pour s'assurer qu'on est en train de donner seulement de l'argent à ceux qui en ont vraiment le besoin et le plus besoin, y compris dans une situation où on ne savait pas exactement ce que les semaines et les mois à venir allaient donner? Ou est-ce qu'on allait prendre une décision d'aider les gens rapidement et suffisamment pour pouvoir passer à travers cette pandémie? Effectivement, c'est un choix que le gouvernement a fait, de dire on va aider les gens et par la suite, on va regarder comment on peut s'assurer que ça a été équitable, comment on peut empêcher ceux qui auraient pris avantage ou exiger des remboursements de ceux qui ont voulu faire de la fraude. Mais ce choix d'aider le plus rapidement possible, le plus de gens possible, c'était le bon choix pour le Canada. Déjà, on a vu que même avec toutes les tragédies qu'on a vécues, la pandémie a frappé moins fort que dans beaucoup d'autres de nos pays alliés. Et en plus, quand on regarde les emplois qui sont revenus au Canada, on est rendu à 80% des emplois revenus qui avaient été perdus à cause de la pandémie et les États-Unis sont à peine à 60%. Donc, on a fait le bon choix, mais effectivement, maintenant, on va être en train de regarder comment on doit continuer d'aider ceux qui sont encore vulnérables et si il y a des gens qui n'ont pas été corrects dans la façon ou des entreprises qui n'ont pas été correctes dans la façon qu'ils ont utilisé ces subventions ou cette aide. Mais la décision de base d'être là pour les Canadiens, c'est la promesse que j'ai faite dès le début. Nous allons nous assurer que c'est le plus équitable possible. Mais d'aider les Canadiens, je ne fais aucune excuse à ce niveau-là.
OK, donc juste pour que ce soit clair, les entreprises qui ont abusé des subventions salariales, qui ont fait des profits avec des subventions salariales, vont devoir les rembourser dans les prochains mois.
On va regarder les règles, si les règles ont été suivies, si tout a été équitable comme il devrait l'être. Mais notre choix, ça a été d'aider d'abord et avant tout à passer à travers cette pandémie et regarder par la suite qu'est-ce qui a été bien utilisé et qu'est-ce qui a peut-être été une opportunité pour certaines compagnies de profiter d'une pandémie, parce que ce n'était pas ça le but. I think people know we made a choice as a government, not a choice that every government around the world did, not a choice that every political party might have made, but we made a choice to help Canadians rapidly at the very start of this pandemic, flowing supports to families, to workers almost immediately, and supports to small businesses and businesses of all sizes rapidly afterwards. And that has worked. That has worked to keep food on the table, to prevent Canadians from plunging deep into debt. It has also worked to hold on for many small businesses and main streets across the country that we'll be able to, instead of having to rebuild from scratch when this pandemic is done, we'll be able to simply reopen. That's going to help us come roaring back. And we're already seeing the impact of that choice we made to help Canadians have positive echoes. People have seen better health outcomes than many of our peer countries around the world in terms of fighting COVID-19. People are also seeing 80% of the jobs that were lost because of COVID-19 already back in our economy, whereas the United States are just around 55 or 60% of those jobs come back. So we've done well because that was the right decision to take. But that choice to get help out quickly to everyone meant that we understood that after the fact, we would have to look at things and see if it was done fairly, if people took advantage of this in improper ways. Like I said, good faith mistakes will not be punished. But there are people who committed fraud and companies who perhaps profited in ways that is not right. And those are things that we will look at. But again, the focus on this pandemic is getting through it. And I think that's what Canadians expected.
Hi, Prime Minister. Tom Perry, CBC. I'm just wondering if you've heard anything from Pfizer about whether they can ramp up deliveries as the year goes on. If you've heard from other companies about how quickly they can deliver, just to get an idea of how quickly vaccines might be coming in. And also, if I could just put a second part on this. A while back, you said that if Canadians buckled down, they might be able to save Christmas. So what do you think went wrong?
I think, first of all, we continue the deliveries of Pfizer, but as we've said, with potential Moderna vaccines arriving before the end of December, pending Health Canada approval, and the Pfizer vaccines already coming in and reaching Canadians, we are very confident about our ability to vaccinate 3 million Canadians at the very least by the end of the first months of 2021. But there's much more to do, and we will continue to work with all the vaccine companies. In regards to Christmas, at Thanksgiving, we saw that cases were rising, and we continue to be in this second wave. But I know that Canadians have been doing the right kinds of things across the country. And yes, people are tired and people are frustrated and cases are still creeping up in some places and going in the wrong direction overall. But I've seen it in the conversations I've had, in reports from across the country, how Canadians get it, that we just need to hold on for a few more months as vaccines are starting to arrive, and we'll get through this. Canadians are pretty good at making it through long, tough winters, and this is going to be a longer and tougher one than we're even used to. But I know, because I've seen people there for each other, people wanting to do the right thing even though it's hard, that we're going to be able to keep cases under control because Canadians stay focused on the things that matter.
Prime Minister Michael Couture from Global National. Despite what you just said in Canadians doing the right thing, in Ontario today we're seeing over 2,000 cases again, and we're going into a period where people are likely going to want to try and bend the rules a little bit. Because of the holidays, they want to get together with people. How frustrating has it been for you that no matter what you say out here and no matter what Dr. Tam says, that the numbers continue to go up somehow?
I think the vast majority of Canadians are being incredibly thoughtful about what they're doing, about how they're keeping themselves, their loved ones, their parents and grandparents, frontline workers safe. But we've seen the challenges of this coronavirus hit extremely hard in communities across the country and indeed in countries around the world. That's why we need to continue to remain vigilant and attentive. But the uncertainty we've had over the coming months, when we didn't even know whether or not there would be a safe and effective vaccine, has now been lifted to a large degree. We know that there will be an end to this COVID crisis. We know that vaccines provide an end, and it's coming. And as tough as this winter is, the spring will be better and the summer may well be much better. But to get there, we have to keep hanging on. To get there, we have to stay disciplined and be there for each other. Because I know as much as many of us want to see our loved ones this Christmas that we won't be able to see except through a TV or computer screen, we also want to be able to see them and give them big hugs next Christmas And our capacity to have them here with us next Christmas depends on all of us thinking about doing our part this Christmas and in the coming months of this winter. Je pense que les gens continuent de faire leur part. On voit que les gens portent des masques, ils gardent leur distance, ils suivent les consignes, même si c'est difficile. Les Canadiens, on est bons à vivre des hivers difficiles. Notre pays, c'est pas un pays, c'est l'hiver. On le sait, on le sent dans tout ce qu'on est. Et cet hiver va être difficile et on va devoir passer à travers. Mais on sait que le printemps s'en vient, puis le printemps va être meilleur. Puis l'été pourrait être encore beaucoup meilleur. Mais à ce moment-ci, il va falloir qu'on réfléchisse à ce que, oui, on veut voir nos êtres chers et nos amis ce Noël. On va seulement pouvoir les voir à travers l'écran d'un ordinateur dans bien des cas. Mais c'est pour pouvoir les voir l'année prochaine, Noël prochain, pouvoir se rassembler et célébrer sans trop d'autres tragédies, sans trop d'autres pertes de parents, de grands-parents, de personnes vulnérables. Tenons bon comme on sait le faire en tant que Canadiens et on va passer à travers.
Hello, Prime Minister. Mike Blanchfield, Canadian Press. As you bid good riddance to 2020, what is your message to the Chinese government on how they ought to be treating Michael Kovrig and Michael Spavor? And could you please clarify earlier remarks you made this week about whether or not you are actually optimistic they will be getting out anytime soon, or if there's any tangible sign of that?
This will be the third Christmas that Michael Kovrig and Michael Spavor spend in arbitrary detention in China. It is incredibly frustrating to me that the Chinese government continues to not understand that Canada is a country that respects the rule of law and will continue to. That we are a country that rejects coercive diplomacy and arbitrary detention, and that China's approach in the way it's been conducting itself is not improving its relations with any country around the world, and indeed is harming its own interests. We will continue to pursue every avenue to bring the two Michaels home as soon as possible. And I remain hopeful to get good news an hour from now, a day from now, a week from now, a month from now. We continue to work and be optimistic that we're going to be able to bring them home. But we will not put in danger other Canadians, and we will not flinch in our defense of the rule of law and of the values that Canadians hold dear. We will continue to stand up for our interests and our citizens every step of the way. Merci beaucoup tout le monde. Thank you guys. Merry Christmas.